Hi, I'm Dr. Michael Flierl. I'm one of the hip and knee replacement specialists with Michigan Orthopedic Surgeons. And today I'll talk a little bit about hip arthritis, what actually happens during arthritis, and what a hip replacement actually looks like, and what we do during a hip replacement surgery. So I brought some models here today that illustrate here in the first model what a native, healthy, young 15-year-old hip looks like. The hip is technically a ball and socket joint where the ball articulates in the socket. And as you can see here on the model, the ball as well as the socket is coated with a thick, nice layer of blue cartilage, which helps the joint glide effortlessly during activities and walking and sporting events and whatever else people want to do with their lives. And as we age, that cartilage layer starts wearing out. Technically, like a car tire that's starting to lose its treads the more you drive on it. And as arthritis progresses, this is what the hip is starting to look like. So the cartilage layer is almost gone. There are bone spurs that have formed on the socket side as well as on the femoral head. And it kind of gets like a rubber road and a rubble road and rougher and rougher. And what then happens is that patients experience limitations in range of motion, limitations in the activities of daily living. They have pain putting on socks and shoes, pain getting in and out of a car, might wake up at nighttime with pain. And this is typically the stage where I see patients in the office. Once we have exhausted non-surgical management options for hip arthritis, we technically talk a little bit more seriously about hip replacement surgery. And so I want to briefly talk about what we actually do during a hip replacement and what that looks like. So there are two components to hip replacement surgery. Number one is what we do to the femur. Number two is what we do to the socket side. So I'll focus on the femur first. What we first do is we basically make a cut, take off the worn out ball that's full of arthritis. And this is technically what the femur then looks like after it has been cut. And then the inside of the femur gets prepared with a special equipment. And then a titanium stem gets press fit into that femoral canal. And finally, a ceramic head goes on top of the femoral implant. That's what we do on the femur side. On the socket side, we clear all the arthritis and the bone spurs and the worn out parts of the hip socket with specialized reamers. And then we insert a metal shell into that native hip socket. And inside that metal shell that's press fit into that hip socket, we insert a plastic liner. And then ultimately what happens is that the ceramic ball articulates with a plastic liner. And this is what a hip replacement looks like. The components are made out of titanium, and bone will actually with time grow into those components, and then it is truly part of the skeleton and usually restores function, restores range of motion, and provides a great amount of pain relief for most of our patients.